Are your muscles aching in the morning, or are your joints stiff and swollen? Could be polymyalgia rheumatica or rheumatoid arthritis, but these conditions are often confused. Today, I'll break down the key differences so you can understand what's really going on with your body. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions such as rheumatology, regenerative medicine, and your metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. What's the difference between polymyalgia rheumatica and rheumatoid arthritis? If you're waking up with stiffness and pain that won't go away, you might be wondering, is it an inflammatory condition like rheumatoid arthritis? Or could it be polymyalgia rheumatica, a lesser known but equally painful condition? Both of these conditions cause morning stiffness, aches, and fatigue, but they affect your body in different ways. So let's break it down step by step. Let's start with polymyalgia rheumatica, or PMR. PMR is an inflammatory disorder that most commonly affects people over the age of 50. It causes pain and stiffness in the shoulders, hips, and upper arms. The stiffness is usually worse in the morning and can make it hard to move. Now, rheumatoid arthritis, or RA, is a bit different. RA is an autoimmune disease where the immune system attacks the lining of your joints, leading to swelling, pain, and long-term joint damage. It can affect people of all ages, but most commonly affects women between 30 and 60 years old. The biggest difference between these two conditions is that PMR mainly affects muscles, while RA directly targets joints, in particular the small joints of the hands and feet, and can cause permanent damage over time. Now let's talk about the symptoms and some of the differences. Both PMR and RA cause significant morning stiffness, but where you feel the pain is a major clue. With PMR, the pain is mostly in the shoulders, hips, and upper arms. There's usually no joint swelling, more stiffness and aching pains that get better as you move. Some people also feel significant fatigue, mild fevers, or weight loss as well. With rheumatoid arthritis, the pain is in the small joints of the hands, wrists, and feet, and sometimes the knees as well. The joints are swollen, tender, and warm to the touch. If left untreated, RA can lead to joint deformity over time. So if your shoulders and hips are primarily stiff and aching, it's possibly more likely PMR. If your fingers, wrists, and feet are swollen and painful, it's likely more commonly rheumatoid arthritis. We don't know exactly what causes PMR, but we do know that it's an inflammatory condition that tends to occur in older adults. It's also sometimes linked to giant cell arteritis, a condition that affects blood vessels, causing inflammation in the blood vessels. RA, on the other hand, is an autoimmune disease, meaning that the immune system mistakenly attacks your own joints. Certain factors like genetics, smoking, and even gut bacteria imbalances may increase the risk of developing RA. So while both conditions involve inflammation, RA is an autoimmune disease, while PMR is more of a generalized inflammatory condition. If you have symptoms of PMR or rheumatoid arthritis, your doctor will likely order blood tests to check for inflammation. For both conditions, we look at the C-reactive protein and the erythrocyte sedimentation rate. These are markers of inflammation. But here's the key difference. Rheumatoid arthritis frequently has specific antibodies like the rheumatoid factor and anti-CCP antibodies that are elevated. These are not found in PMR typically. Imaging such as X-rays or ultrasound can also help. In RA, we often see joint damage or fluid in the joints, while PMR won't necessarily show those changes. So if your doctor suspects RA, they'll likely check for antibodies and joint damage. If those are not present, but you still have widespread muscle pain and inflammatory symptoms, PMR becomes more likely of a diagnosis. And by inflammatory symptoms, I am referring to pains that are worse with rest and better with activity, and prolonged stiffness first thing in the morning. The good news is that both conditions can be treated effectively, but the treatments are a bit different. For PMR, typically low-dose steroids, including prednisone, are the first-line treatment. Most patients feel dramatic relief within days of starting steroids. The key is to gradually taper off steroids over time to avoid long-term side effects. In most people, PMR symptoms will resolve after 3 to 6 months, and your steroid taper will be scheduled around that time frame. In rare cases, inflammation can persist in PMR, and utilizing disease-modifying treatments like methotrexate may be needed. For rheumatoid arthritis, steroids can help in the short term, but RA requires long-term medications called disease-modifying treatments like methotrexate or biologic treatments. Lifestyle changes, including an anti-inflammatory diet, regular exercise, and stress management, can also make a huge difference long-term in RA. RA is by definition a chronic, long-term problem and requires management chronically as well. So key takeaways to summarize: PMR mainly affects muscles, shoulders, and hips, while RA typically affects the smaller joints such as the hands, wrists, and feet. PMR responds quickly to low-dose steroids, while RA requires longer-term immune-modulating treatment. RA has specific blood markers such as the rheumatoid factor and anti-CC antibody, while PMR does not. If you have joint swelling and long-term stiffness, RA is more likely. If your pain is mostly in the muscles and improves quickly with steroids, it may more likely be PMR. If you're experiencing persistent pain, stiffness, or swelling, it's important to see a specialist, such as a rheumatologist, to get the right diagnosis and treatment. If you found this helpful, please make sure to like, subscribe, and share this video. If you have any questions, drop them in the comments. I'd love to hear from you. For personalized treatment options, visit chicagoarthritis.com to schedule a consultation. See you next time, and live well.